When I was in school, one of my teachers told us that ribs are half of the COMLEX. And while I may not agree with it being half of the questions on the COMLEX, there are definitely a large number of questions devoted specifically to ribs. So if you know how to get the correct diagnosis, then you can get the questions correct, and it's some easy points. So to go over it, we're going to do some basic anatomy, some of the movements of the different ribs, the dysfunctions, and how to treat them. So to start off with, we're going to go over the basic anatomy of ribs. There are 5 landmarks on each rib that you're going to need to know. This is going to be the head, the neck, the tubercle, the angle, and the shaft. And these landmarks are going to tell you if the rib is a typical rib or an atypical rib. So a typical rib has all 5 landmarks. It has a head, neck, tubercle, angle, and a shaft. Ribs 3 through 10 are your typical ribs. So if you have typical ribs, you're going to have atypical ribs. An atypical rib either is missing a landmark or has an extra landmark. Rib 1 is atypical because it does not have an angle. Rib 2 is atypical because it has 2 tubercles. So rib 2, 2 tubercles. Ribs 11 and 12 are atypical because they do not have a tubercle. Or a neck. So you need to be able to classify ribs between typical, and atypical. So there are 3 other classifications of ribs that you need to know. You need to know the difference between a true rib, a false rib, and a floating rib. So a true rib is a rib that directly connects to the sternum. So we all know that all 12 ribs begin in the spine and they run all the way anteriorly to the sternum. The true ribs attach directly to the sternum. If we're going to draw this out, it will look like this. Where they attach to the sternum. The true ribs are ribs 1 through 7. Then you have the false ribs. They indirectly attach to the sternum. Their costal cartilage attaches to rib 7, which then attaches to the sternum. And this is ribs 8 through 10. And then you have what's called a floating rib. Floating rib does not connect to the sternum at all. So they're sitting all the way back at the spine without touching the sternum. The next thing that you need to learn is the motion of the ribs. Depending on which rib we're talking about, you're going to have a different type of motion. And there's 3 types of motion. You have pump handle, bucket handle, and caliper. So we'll start off with pump handle. This is going to be ribs 1 through 5. So imagine an old-timey water pump, right? You have to pump the handle to get the water out. So relating that to the ribs, imagine that my elbow is the rib head back at the spine, and my hand is the anterior portion of the rib. When I breathe in, the anterior portion will move upward, and when I breathe out, the anterior portion will move downward. So it's making this pump-like motion. So if I'm going to draw this as a picture, it will look something like this. Where this is the rib, this is the sternum. During inhalation, it moves up, and during exhalation, it moves down. The next motion that we have is bucket handle. And this is ribs 6 through 10. So imagine that you have a water bucket. On the top, it has that wire piece that goes back and forth. So relating that to the ribs, imagine that you're looking at ribs 6 through 10 and my arms are the ribs. When I breathe in, my ribs are going to go up into inhalation like this. And when I breathe out, they're going to swing back down into exhalation. So they move like a bucket handle, just like that. So if I'm going to draw this out, it will look something like this. Where this is the sternum, this is the rib, it moves up and it goes down. The final motion is caliper. And this will be for ribs 11 through 12. So these ribs move a little bit differently. They don't attach to the sternum, so their motion's a little weird. So imagine that the ribs are attached to the back of the spine. When you breathe in, the ribs move outward. And when you breathe out, the ribs come back inward. This motion is called a caliper motion. So drawing this out, this is going to be the spine. Here's your caliper ribs. And now they move outward. So that's your caliper motion. So next we're going to talk about the muscles that you use during respiration. You can have primary muscles and secondary muscles. Your primary muscles of respiration are what you use when you're breathing when you're relaxed. And your secondary muscles are the muscles that you use when you need to get a little bit extra air in and out. So your primary muscles include your diaphragm and your intercostals. Important thing to note here is where the diaphragm attaches to the body. So the diaphragm attaches to ribs 6 through 12, L1 through L3, and the xiphoid. This is an important point for you to keep in mind. So if you're treating the diaphragm, you can do a direct technique where you're actively pushing underneath the rib cage to palpate the diaphragm, or you can treat one of these areas and technically you'll still be treating the diaphragm. You have your secondary muscles of respiration. You have your scalenes. You have pec minor. You have serratus anterior. And you have your lats. So remember, you use your secondary muscles if you need to get a little bit more air in and a little bit more air out. Imagine when you're playing football, you got to breathe heavier. You're going to use your secondary muscles as well as your primary muscles. So what about rib dysfunction? So just like everywhere else in the body and everywhere throughout this course, you always name the dysfunction based off of what it can do. You're going to have two different types of dysfunctions. You can either have an inhaled dysfunction or an exhaled dysfunction. Inhaled meaning that the ribs can go into inhalation, and exhaled means that the ribs can go into exhalation. So we'll start with inhaled. The ribs can go upwards into inhalation, and they cannot go downwards into exhalation. If you're going to treat this type of dysfunction, you use direct pressure. So when the patient is breathing in and the ribs are up, you need to be the person that pushes the rib back down where it should go into exhalation. So the next type of dysfunction is exhaled. And it's going to be the opposite of inhaled. They cannot go up into inhalation, but they can go down into exhalation. So with an exhaled dysfunction, the ribs like to go down and they cannot get back up. The way that you treat these are going to be a little bit different than an inhaled dysfunction. For these, you're going to use muscle energy in order to pull the ribs back up into normal motion. And what muscles are you going to use? You're going to use the secondary muscles. So for rib number 1, you're going to use the anterior and middle scalene. For rib 2, you're going to use the posterior scalene. And then this is where the color coding helps us out. So ribs 3, 4, and 5, we're going to use pec minor. For 6, 7, and 8, we're going to use serratus anterior. And then for ribs 9 and 10, we're going to use the lats. Those are the muscles that you're going to use during your treatment. So how do you find the dysfunction in the first place? What you're going to do is you're going to ask the patient to lay on their back, and you're going to palpate the ribs bilaterally as the patient breathes. When they go into inhalation, all of the ribs should move upward into inhalation. When the patient exhales, all the ribs should go down into exhalation. As you're palpating both sides, you need to make a mental note of which way the ribs go. When the patient inhales and all of the ribs move up, that's great. When the patient exhales, you notice that on the right side, the ribs stay stuck into inhalation and they don't want to go into exhalation. So there's some sort of dysfunction over there. You always name it by what it can do. And since they can go into inhalation, that means it's an inhalation dysfunction. So the final part of this is talking about group dysfunctions. So one way to think about this is to compare it to an accordion. Everybody has an accordion at home that they play, right? So when you're playing the accordion, you go in and out. If one segment of that accordion doesn't work properly, it's going to jam up some of the other folds in the machine. So imagine the same thing for ribs. All of the ribs go upward and downward together. But if one of those ribs don't work properly, the group of ribs beside it is also going to become dysfunctional. That one rib that's causing the dysfunction for the group is called the key rib. How do you identify which rib is the key rib? We're going to use the bite mnemonic. And the bite mnemonic stands for bottom, inhaled, and top, exhaled. So So let's say you have a group inhalation dysfunction of ribs 5 through 7. Which rib is the key rib? Well, using the bite mnemonic, you know it's the bottom rib. So it's rib number 7. If we're going to draw this out, it'll look something like this. So imagine that these are your palpatory findings. This group is the inhaled dysfunction, and the bottom key rib is causing the rest of the ribs to stay stuck in inhalation. So this is your key rib. So this means that if you treat the key rib, the rest of the ribs will fall back into place as they should go. So remember, when the patient goes into inhalation, all of the ribs move up normally. This patient is now in exhalation. The bottom ribs went down normal, but because this key rib is stuck in inhalation, the top ribs cannot go downward normally. So you have to treat the key rib. Now let's do an exhalation dysfunction. Let's say that these are our palpatory findings for a patient during inhalation. The top ribs move normally into inhalation. They all move up. But because this key rib is dysfunctional, it's keeping the rest of the ribs below it in exhalation. So this means that you need to treat the key rib in order to get the rest of the ribs to move normally below it. And how are you going to treat this key rib? Well, it's an exhalation dysfunction. You go back to our exhalation treatments, figure out which rib it is, and then you're going to use that for muscle energy. So in this lecture, we went over everything that you need to know about ribs. We talked about the anatomy and how you can divide the ribs into different groups, the typical motions, including pump, bucket, and caliper, the primary and secondary muscles of respiration, how you name a dysfunction, and group dysfunctions. And that's OMM for ribs.